Yeah, it's a good point, and I think the reasons are not that simple. I mean, some of the clinical trials are industry-driven and really comparing one drug with another. And although there may be differences, it may not change clinical practice to that extent. But then you have to remember that clinical trials are still the best way, not only to show if there's a benefit from a treatment, but clinical trials are also the best way of showing whether there's a harm from a treatment. But there has been some optimism in the last year. If you take the field of heart failure, we've had the trial of sacubitril, which was very, very positive, will change clinical practice, and particularly the two trials of anti-diabetic agents in diabetics, which have shown a reduction in heart failure. So here, out of this massive neutral trials, we do have some very positive trials that will change clinical practice. And I think another example was, if you go back 5 years ago, aldosterone antagonists, 20-year-old diuretic, no one uses it, and it's become one of the most powerful drugs in heart failure. So particularly though in acute heart failure, we've had a lot of neutral trials. It's been very disappointing, but you have to keep trying. I think we design trials well now. We didn't 20 years ago, and I think we learned from the oncologists actually a great deal about the design of trials. Probably we're expecting too much from the drugs, and I think what we perhaps are also doing is maybe oversimplifying. If you take the field of heart failure, where there's an awful lot of trials going on and a lot of different approaches, heart failure is not just one disease, it's probably many diseases, and maybe we oversimplifying, maybe we're asking too much. And maybe it is such a complex disease that the idea that one drug is going to have a huge effect may be a little simplistic. I might add, though, that if you go back 10 years, 10 years was a good time. Beta blockers, ACE inhibitors, aldosterone antagonists, angiotensin receptor blockers, that was a good time for heart failure. I mean, the trials were very positive and have changed clinical practice. Well, I think if they find the answer, I'd love to know it, because we're all battling. We're all battling. And the days when you could read every article in every journal are over. And I think it's just difficult. It's information overload. And what I tend to do is I tend to focus on the major published journal, the major publications in major journals. I think that what has happened and what has really helped us is when you have the big meetings, the ESC and ACC, I think that the blogs are very helpful to identify, whether it's heart.org or many of them. And I think what it is, I find them helpful because they tell me what I missed. And if it looks important, then I'll go back and look it up. But I don't really know of any simple piece of advice to give. We're all struggling. And but I do think that I find a lot of the blogs or summaries helpful about telling me what I'd missed, and then I'll go back and read it.